Bursas are small fluid-filled pillows that are located at and around joints. These bursas are there to provide cushion and shock absorption. The main bursa at the hip that typically becomes angry and irritated in hip bursitis is the trochanteric bursa. Bursas can become irritated during repetitive activities like running, cycling, climbing stairs, a direct blow or fall on the hip, poor posturing of the hip or spine, or even laying on the hip for an extended amount of time. The goal with cupping for hip bursitis is to create space around the bursa so that it has room to breathe and be happy and calm down, and to address any compensatory adhesions that have developed as a result of the body attempting to protect that injured area. A good way to do this is to have the client first in side lying. Then we are going to do several different techniques that are really good for hip bursitis. The first one is frictioning. Frictioning is a technique where the cup is moved back and forth in opposite directions at a pretty steady pace to iron out adhesions. And in the case of hip bursitis, there are typically a ton of adhesions surrounding the anterior, lateral, and even posterior femoral head. Especially in the nooks and crannies around the contours of the bone, adhesions love to hide out here. I like to use the edge cups for this because they come in 4 different sizes, so it's easy to pick the one size that fits the hip the best. You don't want to use a super large cup because the suction on a large cup can be super duper strong and even aggravate the hip bursitis, and it can be kind of cumbersome to try to friction a super large cup in kind of a confined area. There's just no space, not a lot of space for the back and forth movement of the cup. I tend to use a size 2 or 3 edge cup for frictioning over the hip. This way it's small enough that I can grasp it well, and it also allows for good forward and backward movement of the cup during frictioning. And if by chance the cup breaks suction, I can easily with one hand reapply that cup. I like to friction over and around the head of the femur because that area is packed full of bursa sacs that are typically very angry and inflamed and don't have a ton of space. That's why when clients lay on the side that they have bursitis on, the hip begins to hurt. There's not a lot of space, and that pillow is absorbing all the shock because it's attempting to act like a cushion. But now the pillow sac is enlarged and on fire, and when there is compression on it, it smashes that already angry pillow sac, which results in more pain. So here's an example of frictioning. I have my number 3 edge cup. I'm going to do a pinch grip and apply it right over the lateral portion of the hip. I'm not going to apply it at 100% of its suction because, again, 100%, that's a lot of suction, and me attempting to friction that cup may not work at all, and if it does work, it may just be very, very painful for the client. So I'm going to live at and around about 50 to 75%. So I put that cup on, again, 50 to 75%. I'm going to squeeze it just a little bit, not enough to necessarily oval it, but enough that I can get some good control with my hand. I usually brace that client or brace the tissue with my other hand. I'm very right hand dominant, so I brace with my left hand. And I'm going to take that cup and I'm just going to friction right over her hip. Any areas that I found were really, really tight, or that there were a ton of adhesions, or 1 or 2 adhesions, I'm going to put that on my treatment list in my mind, and I'm going to go over right now, and I'm going to iron out or friction around the hip. If I find a spot that I think really needs a lot more TLC, there are a lot of adhesions there, or the adhesions just aren't responding, I'm going to park my cup. I'll go grab another cup, and I can continue my frictioning. Posterior hip, I can go anterior, I can go superior, I can maybe address that IT band. Anywhere in that area that I feel like I need to address, I can do that while that cup is doing that extra TLC around that hip. Give that a try, see how it works out. For the second technique, we want to create space around that angry, puffed up, and inflamed bursa. So this time we are going to focus on lifting, stretching, and creating space in this area. So this time, of course, we are going to pull out the big guns. We are going to use the grips cups because they have great suction and a nice strong handle that we can gently pull on to traction and decompress that area. If the hip or bursa is too inflamed, you may want to use a Lower Essentials edge cup at a reduced suction to avoid causing more pain due to higher suctions or even the heavy snapback after applying the cup. From here, we're going to flip the cup inside out. Dome side is on top. We're going to go right back to that lateral hip. I'm going to put the dome on that hip, and then I'm going to flatten out the cup by pressing down on the edges. A little bit of a snap back. From here, I am going to traction. So I'm going to either pull up, straight up toward the ceiling on the top of that handle, or I can tilt the cup or kind of strategically translate the cup in different directions to get even more lifting and stretching and overall tissue mobility. So I like to do some decompression first and then kind of give a little tilt. So I am tilting the cup in that direction. So we are basically pulling this tissue this way. So we can tilt in this direction. Hold it 3 seconds, 5 seconds. I can hold for even longer, take another cup, and address any other areas that I want at the same time. I can tilt backward, I can tilt forward, I can tilt in any direction that I want to. Taking it a step further, after we traction, we're going to stir the pot a bit. So now we're going to take the cup and move it in a circular motion, clockwise or counterclockwise, or better yet, in both directions. So this is creating more movement. We can do some decompression and stirring the pot at the same time. So this way we are creating a ton of movement in different directions and with all different lines of pull. All these techniques can be done in side lying with the affected hip right side up, or they can be done with the hip adducted down toward the table or toward the floor, like in an IT band stretch to stretch the joint and tissue surrounding the joint while working on ironing out adhesions or creating space at the hip. Sometimes I like to end the treatment session with ice when inflammation is present to put out any smoldering fires that may be lurking and make the hip as happy as possible. Go ahead and give that one a try.